Good morning, everybody. Welcome to Dr. Tom's Tips on Tuesday at 10. My name is Rolando Mea, and we're here with Dr. Thomas Hirsch and a special guest, Laura Murphy, RDH. The purpose of this session is to provide tips regarding utilizing Isolite in different types of dental procedures. Today, our focus is on tips on utilizing Isolite in hygiene. Welcome, Dr. Hirsch. Welcome, Laura. How are you guys?
Doing great.
Hey, Rolando, we're doing great. Hello, everybody. And you know what? We're back to day 2 at work. We're actually going into a full schedule right now, kind of modified full schedule, but we're back at it and we're having at it. So when Rolando this morning told me, hey, we're going to be talking about hygiene today and how Isolite works in hygiene, what do I know about hygiene? I'm not in the ranks every day cleaning teeth and doing all the stuff that our hygienists do that the dentists hate to do. You know, I got two fabulous hygienists in my office, and Laura is one, and she so kindly volunteered to come over and talk to us today about Isolite and hygiene. And she's going to give you some terrific tips on Isolite. So with that being said, I'm going to let Laura take it away.
So before we do that, Dr. Hirsch, the context for hygiene and Isolite, if you could just share your story around how you introduce it into your practice or tips around that.
Sure thing. So I've had Isolite on all my chairs for the past 20 years, set up and ready to go. And obviously I've had hygienists for 20 years. And one of my two hygienists was entirely resistant to utilizing Isolite. And I would go back and forth with her. I said, I want you to use this. No, I don't want to use it. I don't have to use it. It's in my way. And I'm not comfortable utilizing it. Laura, on the other hand, was very good at utilizing it for her SRPs, but she was not utilizing it on a daily basis. So I had massive resistance with my hygienist from utilizing Isolite, and they had the reasons why. So as we're coming back and getting ready and going through our dry runs in dentistry, as far as what we're going to be doing and different procedures and how we're going to be handling the COVID situation, I walked in the office Monday morning and I said, let's go over what our procedures are going to be. In my operatories, this is what we're going to be doing. And in hygiene, you will be doing every procedure with an Isolite. End of discussion. Your employees are looking for a leader. They're looking for a boss. Be the boss, be the leader. Do what you know you need to do to keep your employees safe, your staff safe, your patients safe, and you safe. So I just came in. I made the edict. We're utilizing the Isolite. Period. Any discussion? Nope. Everybody was on board.
Awesome. Thank you for that. So now, thank you for that. Really appreciate it. Laura, what are tips that you would like to give about utilizing Isolite in hygiene?
Well, the first is not to be afraid of it. In the beginning, I was a little hesitant because I thought it might take up too much of my time to implement something new. You know, hygienists are creatures of habit, and we have our routines down that we usually stick pretty close to because of our amount of time we have with each patient, right? But with the Isolite, it's really helped a lot in this environment. I feel much more confident with using it because of the issues with the aerosols. My first tip is to think a little bit differently about how you attack the mouth, basically. Instead of doing arch dentistry, I've switched to quadrant. So I'll place the Isolite after, and then basically do the right side, and I'll do the entire right side. I'll do removing of the calculus, the plaque, then I'll do the flossing and the polishing, remove the Isolite, have the patient sit up, rinse, and then repeat the process on the left side.
Cool. So first, don't be afraid of it.
Don't be afraid.
Second, you're going to have to kind of change a little bit the habits that you've done. What did you have to, or what are some things you had to overcome? What are some tips on how to go from, effectively arch to quadrant dentistry? What tips would you give people?
I was used to doing that because when I had used Isolite in the past for SRPs. And so you're usually doing quadrants when you're breaking up the mouth into quadrants. It's just easier. So I just had to incorporate the polishing and the flossing right into that routine. And the other thing I'd like to say is not to be afraid, and also tell your patients about it. Show it to them before you place it. Show them the light. Tell them the reasons why. because they're also not used to having the iSlide used in a hygiene appointment. And the third is that it alleviates a lot of the issues you have with the suction, having to hold the suction for retraction or hang the suction. It makes it a lot more easier. Once you get in there and you start using it, it really, it makes the procedure go much more smoothly. And it also affords me a level of confidence when it comes to my safety and my patient's safety in the era of COVID.
Awesome. Thank you for that. So we've heard before, there's kind of a habit, because hygienists have been very used to using one hand to retract and also evacuate. What tips would you give people with regard to what to do with that hand now that the iSlide is in there, and how can you, what tips to affect that?
Actually, it gives me more time to use my mirror, right? Because I can use my mirror easier, because usually I'm having to have the patient turn more towards me because I'm having to look and hold the suction. So it makes it easier to actually visualize all the aspects of the tooth.
Awesome. And then do you have any tips with regard to, especially when you're using an ultrasonic and the amount of water or fluid that's being generated when you're using that instrument?
Well, it makes it much easier to control the water. And I like the fact that it wraps around the back of the throat, and it has the bite block. So it makes it, I think, a lot more sanitary and comfortable for the patient. You know, because a lot of times when you're having a hygiene appointment, the jaws get tired, and the patients, that's one of the things that they complain about, so having to have their mouth open, their jaw, the muscles start to get a little tense and painful. So that helps with that, alleviate that as well.
Awesome.
Does it decrease that airborne aerosol by
Absolutely.
by a factor?
Yes, absolutely.
Yeah, okay.
Yeah, cool. And then finally, with regard to mouthpiece sizing, any tips or tricks with regard to advice you'd like to give regarding the size of the mouthpieces when you place them in your patients?
Yeah, that takes a little bit of time in the beginning. Most patients that I work on are medium, you know, but then you do have some people that have very limited openings. The great thing about the iSlide, it has so many different sizes. And is it, doctor, is it like 2 fingers for medium, or usually
3 fingers for a medium and 2 fingers for a small, but
yeah.
we just go back and forth, and you learn after a while. You've
Once
got to
you
dance
look,
with
you
it for
can
a
kind of-
while.
Yeah, you'll be able to visually just kind of decide.
Awesome. So I'm taking away, don't be afraid of it. That's the first thing. Second, there are a range of different sizes. So work with that, experiment with that. Third, you will have to shift from doing full arch to quadrant. So there's kind of a little bit of a learning curve, but the benefits are huge. Fourth, it sounds like, especially with any of your ultrasonic instruments, you can have a ton of water in there and it's going to come out, right? Fifth, it frees up your other hand to be able to give you better retraction. You have better access, that type of stuff. Yeah. I'd say 6, you can slap your dentist around if you want to with that other hand. No, I'm joking. Sorry. Anything else? Anything else you'd like to share regarding things that could help people as they start using iSlide in hygiene?
Like I said before, it's in the beginning, it's a little bit of a change, but after like 3 patients, you got it. It becomes like second nature, and I feel that it really actually helps my hygiene appointments go a little more smoothly. And like I said, the patients seem to like it. They're more comfortable. They're not having to worry about the water pooling, and that's about it.
I'll throw one thing in there. Try using it with sealants. Try using it with sealants. When the hygienists do sealants, I do most of the sealants in the office, but when the hygienists do the sealants, it's that extra set of hands. So yeah, I'll leave you with that. I'll leave you with that one.
Perfect. And then finally, as a dentist, as the owner of the practice, to ensure safety, especially now when we're not quite clear with regard to eliminating aerosols, make it a protocol, establish it as fact, and you ensure that patients, your staff, yourself are safe. So.
Well, yeah, and then the last thing that I really want everybody to remember, you're the dentist and the buck stops here. The buck stops right here with me. Buck stops for you, the dentist. You are the person in command. You make the rules. That's where the buck stops.
Awesome. Thank you so much for your time, Laura. It was a pleasure meeting you, and thank you for sharing those.
Thank you. Thanks, Laura.
Dr. Hirsch. Those of you
Rolando, thank you.
watching, if you like this content, please share it with other people. If you have additional things that you'd like to learn or other tips you'd like to earn from Dr. Hirsch and his team, please let us know. Thank you so much for joining us for Dr. Tom's Tips on Tuesdays at 10.
Thanks,
Take
everybody.
care, everybody.
Thank you.